There are a lot of respiratory-related diseases in the country. One of the common is pulmonary tuberculosis. So pulmonary tuberculosis is caused by Mycobacterium tuberculosis that mainly affects the lungs. Though there are some data and studies that it can also affect some organs and parts in our body. Also, this is considered to be a communicable disease because it can spread through airborne, just like talking, sneezing, or even persistent coughing. Oh, are you okay?
Yes, sir.
So going back, there are a lot of symptoms that might a patient with tuberculosis, pulmonary tuberculosis can experience. One of which is persistent coughing, chest pains, fatigue, weight loss, night sweats, and even coughing of blood. While many people do not experience symptoms of pulmonary tuberculosis are those individuals whose immune system are being compromised. Such individuals who are diagnosed with HIV or AIDS or any other chronic conditions are greater risk. Though there are a lot of diagnoses to be done for you to know if you have pulmonary tuberculosis, just like chest x-rays, sputum tests, and other microbiological cultures.
Pulmonary tuberculosis is a serious infection caused by the bacterium Mycobacterium tuberculosis or MTB that involves the lungs but may spread to other organs. TB is a contagious disease that can infect anyone exposed to MTB. Johann Schönlein coined the term tuberculosis in the 1834, though it is estimated that Mycobacterium tuberculosis may have been around as long as 3 million years. In the 1700s, TB was called the white plague due to the paleness of the patients. TB was commonly called the consumption in the 1800s, though even after Schönlein named it tuberculosis. During this time, TB was also called the captain of all these men of death. Today, our names for TB tells us where TB is located, just like pulmonary and extrapulmonary. There are a lot of treatments to treat TB, just like drug susceptible, drug resistant, multi-drug resistant, and extensively drug resistant.
Unlike TB infection, when a person gets TB disease, they will have symptoms. They may be mild for many months, so it's easy to spread TB to others without knowing it. Common symptoms TB are the following: prolonged cough, sometimes with blood, chest pain, weakness, fatigue, weight loss, fever, and night sweats. The symptoms people get depend on where in the body TB becomes active. While TB usually affects the lungs, it also affects the kidneys, brain, spine, and skin.
Tuberculosis or TB commonly presents symptoms such as cough, like that lasts for more than 3 weeks. It is often accompanied by chest pain and coughing up blood. People with TB also experience fatigue, unexplained weight loss, and a lack of appetite. As the infection progresses, breathing may become more difficult and shortness of breath may develop. If these symptoms persist, consult your doctor.
Do you all know? Tuberculosis is one of the oldest recorded diseases, with evidence of TB found in Egyptian mummy dating back 2400 BCA.
Here are some 5 prevention and intervention for pulmonary tuberculosis. Prevention. First, avoid close contact with active TB patients. If someone has TB, especially pulmonary TB, they can spread the disease through the air. Try to avoid prolonged contact with them, particularly in closed spaces, until they are receiving appropriate treatment and no longer infectious. Second, practice good respiratory hygiene. Hand hygiene, covering the mouth, nose when coughing or sneezing, and using tissues help prevent the spread of TB. Third, boost your immune system with proper nutrition and exercise. A healthy immune system can help fight off infection, including TB. And now, let's going to talk about the interventions. First, anti-TB medication. Administer a combination of first-line antibiotics for at least 6 months to treat active TB and kill the bacteria. Second, directly observe therapy. Healthcare workers or trained individuals observe the patients taking TB medication to ensure adherence and prevent missed doses, reducing the risk of drug resistance. 3. Contact tracing. Identify individuals who have been in close contact with a TB patient and provide screening and preventive treatment. 4. Follow infection control protocols in high-risk settings. In healthcare settings, especially where TB patients are treated, adhere to a strict infection control measures. This includes wearing masks, gowns, and gloves, ensuring proper ventilation, and isolating infectious patients when necessary. Fifth, complete treatment for latent TB. Completing treatment for latent TB prevents progression to active TB.
Pulmonary tuberculosis TB treatment primarily involves a combination of drugs, isoniazid, rifampin, pyrazinamide, and ethambutol. The first 2 months focus on an intensive phase with all 4 drugs, followed by 4 to 7 months of just isoniazid and rifampin. To ensure adherence, directed therapy or DOT is recommended, where a healthcare provider supervises the patient taking their medication. Regular monitoring for side effects like liver toxicity is crucial, along with periodic tests for drug resistance. In cases of drug-resistant TB, second-line drugs may be needed, and in severe cases, surgery may be considered. Patient education on medication adherence and preventing TB spread is key to successful treatment.
Hello everyone. Today, we'll focus on specialized aspect of tuberculosis management, surgical intervention. Although medical therapy is a primary treatment for tuberculosis, surgery becomes vital in certain cases. Let's discuss when and why it's needed. Surgery is reserved for cases where medical treatment isn't sufficient. This includes, first, complications, like massive hemoptysis. It is a life-threatening bleeding that demands urgent action. The next one is the chronic bronchiectasis. It is a persistent infection unresponsive to antibiotics. The last one is the epiema, or the bronchopleural fistula, infections affecting the pleural space. Second one is the localized disease, solitary lesions or tuberculomas not responding to drugs. The third one is the drug-resistant tuberculosis, cases of multi-drug resistant tuberculosis and extensively drug-resistant tuberculosis that persist despite optimized treatment. The fourth one is the suspicions of malignancy, lesions resembling cancer requiring biopsy or removal. The fifth one is the airway obstruction, scarring or lymph node compression, impeding airflow. Types of surgical procedures. The procedure depends on the condition. First, lobectomy or segmentectomy. It removes affected lung segments for localized disease. The second one is pneumonectomy. It involves removing an entire lung in severe cases. The third one is decortication. This removes thickened pleura in chronic epiema to expand the lungs. The fourth one is the thoracoplasty, rarely performed, collapses an infected lung by rib removal. The fifth one is the bronchial stump repair, addresses bronchopleural fistula after surgery. Preoperative considerations. First, improving overall health. Address malnutrition and anemia. Second one, controlling infection. Anti-TB therapy should precede surgery unless urgent. The third one, assessing lung function. Ensure the remaining lung can handle the post-surgery demands. Next is post-operative care. After surgery, we need to focus on continuing anti-tuberculosis therapy to clear residual infection. Next, monitoring for complications like respiratory failure or infections. Next, supporting recovery with physical rehabilitation. Surgical management of pulmonary tuberculosis is a secondary approach for complex cases. With proper planning and medical therapy, it significantly improves outcomes.
Do you all know TB is one of the top most infectious killers worldwide? According to WHO, about a quarter of the world's population is infected with Mycobacterium tuberculosis, although most have latent TB.
In 2023, the Department of Health reported 612,524 new and relapsed TB cases, This reflects a case notification rate of 549 per 100,000 population, showing a rise from the previous year. The country remains one of the top contributors to global TB cases. Approximately 70 Filipinos die daily from TB, underlining its public health impact. Poverty, crowded lining conditions, and poor nutrition are major risk factors exacerbating the problem. Of those who developed TB, 55% were men, 33% were women, and 12% were children and adolescents.
TB mostly affects adults in their most productive years. However, all age groups are at risk. Over 80% of cases and deaths are in low and middle income countries. In 2023, an estimated 10.8 million people fell ill with TB worldwide, including 6.0 million men, 3.6 million women, and 1.3 million children. Tuberculosis occurs in every part of the world. In 2023, the largest number of TB cases occurred in the World Health Organization Southeast Asia region with 45%, followed by the African region with 24%, and the Western Pacific region with 17%. Around 87% of the new TB cases occurred in the 30 high tuberculosis burden countries, with more than two-thirds of the global total in Bangladesh, China, Democratic Republic of Congo, India, Indonesia, Nigeria, Pakistan, and the Philippines.
Hello everyone, let's briefly talk about the complications of tuberculosis, both when it's left untreated or even after treatment. First is lung damage. The bacteria destroys lung tissue, leaving scars that makes breathing hard. This will make you feel short of breath even doing simple tasks. Second, it spreads to other organs such as brain, spine, kidneys, or even your heart, which causes serious problems. It can also weaken your bones and joints, making them brittle and painful. Another issue is fluid in the lungs, which makes it hard for the lungs to expand, leaving you constantly out of breath. If left untreated, TB can spread uncontrollably, leading to death as the body's systems are overwhelmed. Even after treatment, TB can leave long-term lung problems like scarring, shortness of breath, or chronic cough. If TB spreads to other parts of your body, the organ damage might not fully heal, leaving lasting effects such as memory problems or reduced kidney function. You might also experience chronic fatigue after treatment as your body recovers from both the illness and the strong medications. Lastly, TB can weaken your lungs, leaving you at higher risk for infections like pneumonia in the future. In short, TB is very serious, but it's preventable and treatable with proper care. Just make sure to seek treatment early to avoid these complications. Thank you.